What is Down syndrome? Down disorder is a hereditary condition that causes gentle to serious physical and formative issues. An extra chromosome is present at birth in people with Down syndrome. Chromosomes are heaps of qualities, and your body depends on having the perfect number of them. With Down disorder, this additional chromosome prompts a scope of issues that influence you both intellectually and genuinely. Down syndrome lasts a lifetime. Despite the fact that it can't be restored, specialists find out about it now than at any other time. In the event that your youngster makes them get the right consideration from the beginning can have a major effect in assisting them with carrying on with a full and significant life. Down syndrome symptoms. The effects of Down syndrome can be numerous, and they vary from person to person. Some will live almost entirely by themselves as children, while others will require more assistance taking care of themselves. Mental capacities differ, yet a great many people with Down condition have gentle to direct issues with thinking, and understanding. They will acquire new skills throughout their lives, but it may take them longer to achieve significant objectives like walking, talking, and developing social skills. People with Down syndrome tend to have certain physical features in common. These may include 1. Eyes that slant up at the outer corner. 2. Small ears. 3. Flat noses. 4. Protruding tongue. 5. Tiny white spots in the colored part of the eyes. 6. Short neck. 7. Small hands and feet. 8. Short stature. 9. Loose joints. 10. Weak muscle tone. Many people with Down syndrome don't have any other health issues, but some do. Common conditions include heart problems and trouble hearing and seeing. Down syndrome causes and risk factors. For most people, each cell in your body has 23 pairs of chromosomes. One chromosome in each pair comes from your mother and the other comes from your father. But with Down syndrome, something goes wrong and you get an extra copy of chromosome 21. That means you have 3 copies instead of 2, which leads to the symptoms of Down syndrome. Doctors aren't sure why this happens. There's no link to anything in the environment or anything the parents did or didn't do. While doctors don't know what causes it, they do know that women 35 and older have a higher chance of having a baby with Down syndrome. If you've already had a child with Down syndrome, you're more likely to have another one who has it as well. It's not common, but it is possible to pass Down syndrome from parent to child. Sometimes, a parent has what experts call translocated genes. That means some of their genes aren't in their normal place, perhaps on a different chromosome from where they'd usually be found. The parent doesn't have Down syndrome because they have the right number of genes, but their child may have what's called translocation Down syndrome. Not everyone with translocation Down syndrome gets it from their parents, it may also happen by chance. Types of Down syndrome. There are 3 types of Down syndrome. 1. Trisomy 21. 1. This is by far the most common type, where every cell in the body has 3 copies of chromosome 21 instead of 2. 2. Translocation Down syndrome. 2. In this type, each cell has part of an extra chromosome 21, or an entirely extra one. 2. But it's attached to another chromosome instead of being on its own. 3. Mosaic Down syndrome. 3. This is the rarest type, where only some cells have an extra chromosome 21. You can't tell what type of Down syndrome someone has just by how they look. The effects of all 3 types are very similar, but someone with mosaic Down syndrome may not have as many symptoms because fewer cells have the extra chromosome. Down syndrome diagnosis. A doctor may suspect Down syndrome in a newborn based on the baby's appearance. That can be confirmed by a blood test called a karyotype test that lines up the chromosomes and will show if there's an extra chromosome 21. Down syndrome treatments. There's no specific treatment for Down syndrome. But there is a wide range of physical and developmental therapies designed to help people with Down syndrome reach their full potential. The earlier you start them, the better. Each child will have different needs. Yours may benefit from 1. Physical, occupational, and speech therapy. 2. Specialized education services. 3. Social and recreation activities. 4. Programs that offer job training and teach self-care skills. You'll also work closely with your child's doctor to watch for and manage any health problems associated with the condition. Down syndrome complications. Babies with Down syndrome may be born with other physical problems, and they're at higher risk for certain health issues later in life. Possible complications of Down syndrome include 1. Heart problems. 1. About half of babies with Down syndrome are born with a heart defect that may need surgery. 2. Hearing and vision problems, including crossed eyes and cataracts. 3. Gastrointestinal disorders, like blockages, reflux, and celiac disease. 4. Obesity. 5. Breathing issues, including sleep apnea, asthma, and pulmonary hypertension. 6. Underactive thyroid. 7. Seizures. 8. Childhood leukemia. 9. Early onset dementia.